everyone, my name is Dian Asa. Today I will be presenting a topic of hepatitis. Next, I will discuss topics related to hepatitis, namely of definition, facts, opinions, types of hepatitis, cases, symptoms, and treatment. First, I will explain definition of hepatitis. Hepatitis is a liver disorder that involves inflammation of the liver. The inflammation is characterized by elevated levels of liver enzymes, which are caused by disruption or damage to the liver membrane. Let's now turn to the facts of hepatitis. Based on data from the World Health Organization in 2019, it is estimated that 354 million people in the world are living with hepatitis B and C virus, but hepatitis B and C viruses can cause lifelong infection. World Health Organization estimates that 1.1 million deaths occurred in 2019 from hepatitis infection due to chronic condition caused by viral hepatitis. Hepatitis A does not cause chronic infection but can cause severe liver damage that can lead to death. According to the Centers for Disease Control and Prevention in 2020, it is estimated that there are 90,900 people worldwide infected with hepatitis A, where 9,952 new cases have been reported during 2020. According to World Health Organization, Indonesia ranks fourth in the Southeast Asia region for incidence and mortality from liver disease. Let's now turn to the opinion of hepatitis. The reason I chose the topic of hepatitis is because this disease was prevalent in its time, and even though hepatitis still exists, although it has begun to decline. Let's now turn to of hepatitis A. Cases of hepatitis A. Drug foods are being contaminated with hepatitis A virus. Lack of sanitation standards because people with hepatitis A process food without washing their hands before and after cooking. Consume contaminated food. Have close contact with people infected with hepatitis A virus. Have sexual intercourse with people with hepatitis A. Next, I will explain the symptoms of hepatitis A. Excessive fatigue, nausea and vomiting, diarrhea, no appetite, upper right abdominal pain, pale grayish clay-like stools, dark and thick tea-like urine, fever, joint and muscle pain, severe itching, headache, sore throat, cough, yellowing of skin and eyes. Treatment of hepatitis A. Hepatitis A has no specific treatment. This is because the immune system will fight the virus and the condition will resolve on its own. The liver cells will recover without leaving any permanent damage within 6 months. For this reason, doctors will usually suggest some steps to manage and alleviate the symptoms of hepatitis A. Next, I will explain the hepatitis B. Cases of hepatitis B: drug and protect sexual intercourse, blood transfusion, drug needles, razors, tattoos, organ transplants. In rare cases, pregnant women infected with hepatitis B virus can transmit the virus to their fetus. Next, I will explain the symptoms of hepatitis B. Loss of appetite, nausea and vomiting, flu-like symptoms and fatigue, body aches, headache, high fever, right upper abdominal pain, diarrhea, yellow eyes and skin. Most patients with chronic hepatitis B are asymptomatic. If less than 6 months, it's called acute hepatitis B, and if more than 6 months, it's called chronic hepatitis B. Next, I will explain the treatment of hepatitis B. There is no specific method to treat acute hepatitis B, as hepatitis B resolves on its own. If symptoms are present and bothersome, then insult be treated, such as the antiviral drug lamivudine if chronic, lamivudine, adofovir, entecavir, telbifudine, and tenofovir. Let's now turn to hepatitis C. Hepatitis C is caused by infection with the hepatitis C virus. Hepatitis C is a condition that requires immediate treatment because if left untreated in the long term, it causes damage to the liver. Causes same as hepatitis B. Next, I will explain the symptoms of hepatitis C. Muscle and joint pain, pale stools, nausea and vomiting, fatigue, low-grade fever, loss of appetite, take urine, about 20% of people with hepatitis C saw yellowish skin and ash during infection. Almost 80% of patients infected with hepatitis C will become chronic hepatitis C. Next, I will explain the treatment of hepatitis C. Hepatitis C generally resolves on its own. However, in some cases, hepatitis C may develop long term. In such cases, the doctor may administer antiviral drugs or suggest a liver transplant procedure if complications arise. Let's now turn to hepatitis D. Hepatitis D is a type of incompletely formed RNA virus that requires hepatitis B as a host to replicate. Next, I will explain the cases of hepatitis D. Suffering from hepatitis B, having sex with multiple partners, living with a patient or in hepatitis D outbreak area, receiving blood transfusion, sharing needles with people with hepatitis D. Next, I will explain the symptoms of hepatitis D: yellowing of the skin and whites of the eyes, joint pain, abdominal pain, nausea and vomiting, decreased appetite, dark urine, pale stools, fatigue of unknown cause. In addition, the virus can accelerate the process of liver fibrosis, which leads to liver cirrhosis and increases the risk of liver cancer. Next, I will explain the treatment of hepatitis D. Patients with hepatitis D will receive interferon injection every week for 12 to 18 months. Liver graft surgery is performed if the hepatitis D patient has developed liver damage due to cirrhosis and fibrosis. Regular visits to the doctor are required at least once every 6 months to monitor the progress of hepatitis B and the infection. Let's now turn to hepatitis E. Hepatitis E is a disease caused by the hepatitis E virus, a spherical RNA virus. Next, I will explain the cases of hepatitis E. Living in environment with poor sanitation, traveling to an area with a high rate of hepatitis E virus infection, consume foods and drinks that have been contaminated with the hepatitis E virus, having sexual intercourse with multiple partners and not using a safety device. It is rare, but pregnant women infected with hepatitis A are at risk of transmitting it to their fetus. Consuming poorly cooked meat, receiving blood transfusion from hepatitis A infection donors. Next, I will explain the symptoms of hepatitis A: jaundice, fever, dark urine, pale stools, nausea and vomiting, abdominal pain, fatigue, decreased appetite, skin rash and itching, joint pain. Next, I will explain the treatment of hepatitis E. Acute hepatitis E tends to resolve on its own without treatment. Patients with acute hepatitis E will generally be advised to get plenty of rest, eat healthy foods with balanced nutrition, and drink enough water. Doctor will also prescribe pain or fever medication if the patient's hepatitis E symptoms are acute bothersome. Chronic hepatitis E is treated by prescribed antiviral drugs such as ribavirin or interferon alpha 2. Doctor will consider a liver transplant if chronic hepatitis E causes severe liver damage. After undergoing a liver transplant, patient will still need to take antiviral drugs for 3 to 12 months. Before I end my presentation, let me just say quotes. Love your liver so your life is longer. Thank you for listening my presentation.